Sleep. It makes up more than 30% of our lives. But sometimes we forget the importance of a good night's rest, even when we feel the effects of a bad one. Our bodies operate on a 24-hour sleep cycle known as the circadian rhythm, a biological clock of hormones and chemical reactions that regulate our recovery and work from day to day. Evolutionarily, this was designed around the general patterns of sunrise and sundown, where we would experience fatigue and sleepiness at night and wake up near sunrise. In the modern day, it's not so simple. While experts recommend that most adults get between 7 and 9 hours of sleep, around 30% of people worldwide are not achieving even 6 hours of sleep each night, and roughly 35% of all adults in the United States report their sleep quality to be poor or fair. For children and teens, the sleep recommendation is even larger due to their developmental requirements. Teens are recommended to achieve around 8 to 10 hours of sleep, but only about 30% of high school students are achieving this goal. The implications of sleep deprivation are dire. Sleep deprivation has been associated with increased incidence of mental health disorders like depression and anxiety, or overall exacerbation of pre-existing mental health disorders. Additionally, sleep deprivation can impact how we process information, leading to memory problems or decreased retention, important both in school-age children and in working adults. Chronically, sleep deprivation can lead to various sleep disorders, of which 50 million Americans are reported to have some form of sleep disorder, with the most common diagnosis of sleep disorder being one that you may be familiar with: insomnia.
Insomnia is defined as an individual's report of dissatisfaction with sleep quality or quantity. It is characterized by trouble falling asleep, staying asleep, or returning to sleep after early morning awakening. To be diagnosed, one must experience these symptoms at least 3 nights per week for at least 3 months. Symptoms from factors such as side effects from medication or alcohol consumption are not considered in diagnosis. Negative consequences associated with chronic insomnia include a decreased quality of life, increased risk of accidents, and decreased work productivity. Relatedly, there's a high rate of psychiatric comorbidities seen in patients with chronic insomnia. Although many adults suffer from at least one symptom of insomnia, insomnia is more prevalent in women and older adults, as well as those living in cities. One interesting cognitive component of insomnia is the inability to fall asleep due to a lack of understanding of when our body truly falls asleep. Some experts recommend a new form of sleep retraining.
Like one of the cool but also crazy new methods of treating insomnia is basically sleep retraining. They do this, you don't sleep for 24 hours so that you're desperate to sleep, right? So there's more likelihood that you're going to fall asleep easy. So you have to do sleep deprivation first, and then they put you in a lab and they let you fall into stage 1 sleep for 5 minutes. And then after 5 minutes, they wake you up. And they do that continuously throughout an entire night span, so that every time you fall asleep, they wake you up to teach you that you were asleep. And so that you recognize stage 1 sleep and let yourself go from stage 1 to 2 and 3 and 4.
This may be an effective way to both reset sleep schedule, as well as learn the psychological cues for those who are at their wits' end in dealing with chronic insomnia. Due to the sleep deprivation aspect of this therapy, it is often a last resort, but has been shown to potentially be effective. More common ways of treating insomnia include prescriptions of cognitive behavioral therapy and medication. These are all sleeping pills prescribed by a doctor that can be used in the short term, but they can lead to further sleeping impairments after their use is finished, leading to relapses in progress or eventual worsening of symptoms. Instead, physical activity is a long-term solution that can be prescribed as a way to potentially increase sleep duration and quality.
Research shows that light and moderate leisure time physical activity can help improve the quality of our sleep and improve various aspects of our livelihood, such as quality of life. Further, aerobic physical activities such as long-distance running, swimming, or cycling can be an effective treatment option when combined with appropriate sleep hygiene, like sticking to a consistent sleep schedule. However, too much physical activity or the wrong type can decrease sleep quality. For example, athletes who train a lot may experience symptoms of overtraining, which can lead to decreased sleep quality or decreased total deep sleep, the most restorative phase of our sleep cycle. Additionally, occupational physical activity is not considered to be leisure time activity and is often associated with decreased sleep quality due to its association with livelihood and the accompanying stressors at work. Rigorous occupational physical activities such as farming, construction work, or other physically demanding occupations can decrease sleep quality due to these stressful associations. Finally, the timing of physical activity can also play a distinct role in our ability to fall asleep when we finally set our heads down. Experts say that exercise too close to sleep can halt the sleep process.
So, with physical activity specifically in relation to sleep and insomnia, so one thing that we see is that exercising or physical activity at a high level too close to bed can worsen insomnia. Part of this is because there's an endorphin release. This might feel activating, maybe even feeling energizing, making you feel more alert, which is problematic when we're trying to kind of ramp things down rather than ramp things up. So the recommendation with this one would be to try to keep exercise earlier in the day if possible. The research has shown that even like an hour before you go to bed might be fine. I'll also say that's cutting it close. So I would say try to avoid exercising even between like 2 to 4 hours of going to bed if possible.
So what about those of us who may be at risk of developing chronic insomnia? Research in this area shows that a consistent exercise schedule on a daily basis can stave off chronic insomnia. In a 2017 study in Chinese adults, physical activity was shown to decrease the chances of being diagnosed with chronic insomnia. So what if you are already diagnosed with chronic insomnia? Can physical activity help you too? Research shows moderate effects of reducing symptoms of chronic insomnia, but it can be much more difficult because of the depressive nature of insomnia in the first place. You may already be tired and not motivated to engage in any physical activity. This can be a problem when attempting to treat chronic insomnia. However, when combining a regular exercise program with aspects of sleep hygiene, many patients have noticed a marked decrease in insomnia symptoms, allowing them to regain control of their sleep schedule and daily functioning.
The good news is there's a lot that you can do when it comes to insomnia, when it comes to sleep. A lot of times this is talked about in terms of sleep hygiene as a common way that we conceptualize this or talk about it. Important ones or big ones that I'll throw out there, and this is not an exhaustive list, but avoiding naps can be a big one. I know that isn't always fun advice to hear, but trying to not nap or trying to keep naps pretty short or earlier in the day can have really important and really beneficial impacts on sleep and sleep quality. Trying to keep a consistent routine, so trying to go to sleep and wake up at somewhat similar times throughout your week can also be really helpful. If you can't sleep or you're in bed and you're not able to fall asleep, one common technique would be actually getting up for about 20 minutes, doing something boring, non-stimulating, and then reapproaching bed when you start to feel tired again. Other things would be like using your bed for sleep only, trying to not like eat snacks in there, use your laptop or do other stuff. Just keep it pretty specific to sleep. Avoiding substances that have a stimulating effect. Big ones are caffeine, alcohol, and nicotine, trying to avoid those and minimize use of those. And then another one, and this is pretty specific, but if folks know of like sleep math, so looking at your clock and constantly calculating how many hours of sleep that you can get a night can actually keep you awake. And so even removing the clock or turning it over so you're not distracted by that. Again, there's a pretty long list of stuff that you can do related to sleep, but these are the ones that I typically recommend people early on and have shown to be fairly effective.
Appropriate sleep hygiene is effective in helping people fall asleep, but can be made even more effective with regular physical activity. Although the specific biological mechanisms that explain why physical activity improves sleep still eludes experts, it is speculated that body temperature changes, increased energy consumption, central nervous system fatigue, and changes in heart rate and heart rate variability may precede the outcome of improved sleep quality. In effect, by working the body, we may force it to recover in a way that may be useful for falling asleep. For more information, visit the American Psychiatric Association or Center for Disease Control and Prevention websites.